Hi, everybody. Welcome to the Mary Zilba podcast. Thank you so much for coming here and for our new subscribers. Thank you. Today, I have an amazing guest on. Her name is Dr. Monica Lee. She is a double board certified dermatologist and an associate clinical professor at the University of British Columbia in Vancouver. And she knows skin. She knows everything about skin. And we're going to hear from her about lasers. In fact, she's a laser expert. We're going to talk about which procedures, treatments are good, which ones are just a bunch of hype. And we're going to talk about all kinds of stuff that I know you're also dying to know about. So, ladies and gentlemen, please welcome Dr. Monica Lee.
Oh,
Hey,
hi,
thank you
Mary.
so much for coming on the podcast. I have so many things I want to ask you, and you know that I'm so excited that you're on the podcast because I've had on a plastic surgeon just recently talking about facelifts and stuff like that. And so, that was really interesting. But everybody's talking about skincare, and
Yes.
it's so confusing, I think, for people right now because there's so much out there. And
Mhm.
so I have so many questions to ask you because I, for one, have been a person that uses a certain product that I've used for 35 years. I'm going to tell you what that is in a minute. But it's like people don't know what is, even young kids are starting really early with Botox
Yes.
and fillers and all
Yes.
kinds of products. Like, what trends are you feeling right now that, I mean, do you think that people are overdoing it? Do you think that we should step back a little bit and not overload? What are your feelings on that?
Well, like I think if you start with skincare, first of all, there's definitely a lot of growing interest, especially amongst young consumers. Probably a lot of it is due to social media and what information or misinformation can be
Yeah.
accessed nowadays. It's so easy at the tip of the fingers, and people are always scrolling through things. Whether it's on TikTok or Instagram or whatever channels, YouTube that there are. So with skincare, I think that it's not so much, this is not just like the women routine. This is now teenagers and young teenagers and older kids are very much interested. And hence why you're seeing this phenomenon previously, especially this past year, of, Sephora hashtag kids, or
Yeah.
like, the
Yeah.
teen or tween skincare, and it's because of that. It's related to that. And then when you're talking about like treatments, there's also a focus on having flawless skin, having the perfect complexion. Again, it's related to social media because there's filters that are now in place. So everybody always looks so good. And the
Yeah.
skin
Yeah.
has any blemishes. There's never any pimples. There's no pores. Everything just looks so fair and so even. When in reality, that's, none of us really have flawless skin all the time, every single day. And so the
Yeah.
treatments that are related to it is because of the drive to kind of seek that kind of perfect complexion. There's certainly lots of attention now amongst younger consumers with regards to preventative treatments. So things like, your baby Botox, or if patients or individuals are interested, they might be looking at skin complexion injection treatment. So it's like an injectable moisturizer to make the skin glow, not because someone has hollowing or they have folds or they have lots of wrinkles, but even before all that shows up, it's just about kind of improving complexion and making sure that they have this filter-like skin. And I
Yeah.
think that's what's driving a lot of some of the earlier treatments for younger patients, younger individuals, where whether it's, these cosmetic injectables that are to improve hydration, or it's laser treatments to make the skin glowier, or even sometimes we have younger patients now seeking skin tightening treatments for prevention. So it's not like there's any sagging, there's no loose skin, but there is definitely science, and this science is now kind of going mass market, so
Yes.
that
Yeah.
the average consumer understands that there's benefit to being preventative rather than reactive. And so there's an interest now, even in some of the treatments that are non-invasive, non-surgical. Previously, these treatments are more for, or sought after by people in their mid 40s, late 40s onwards. But now we have individuals who are in their 20s and 30s. They're like, I know I'm not aging. I know I don't have signs of aging,
Yeah, but
but
do you
I
think
want to
that's
be
what it is,
proactive.
doctor? Do you think it's that everybody it's now like not about it's anti-aging, but it's aging before like someone my age, I'm trying to prevent it from getting worse. But when you're really young, is it does it do more harm than good to
Mm,
like some of these kids are putting so much stuff on at night that I'm like, wow, that's like 10 products you just stuck on. I'm looking at TikTok and I'm like, one layered after another. And I'm like, how can your skin
uh,
even breathe? Does that work?
yes. Yeah. So first of all, Mary, I think you're not giving yourself enough credit. I think you look great.
Thank you.
So you look great. There's
Thank
nothing
you.
that's like you look great.
Thank
So
you.
but I think the skincare 10 step, 50 step, 20 step routine that um well, young people, but also, women in their mid 40s, 50s, 60s, they're also doing, it's a little bit unnecessary. And a lot of it probably comes down to a bit of the marketing that's out there, saying that these products, you just really need these products. You need these things. When I think going bound back to the non-negotiables, having a simple cleanser that's of course compatible with the individual, having that cleanser, and then having the sunscreen. And then you can build upon that non-negotiable three-step routine,
Yeah.
where if someone has extra pigment and there is uneven skin tone, you can add something that targets and lightens and fades pigment or brown spots a little bit over time. If someone has a lot of redness of their face and they're not ready to do treatments yet, and assuming, of course, there's no underlying medical conditions like rosacea that has to be treated medically, then there could be products that can calm the skin or soothe the skin. So you can add that step in. But the non-negotiables that I think, whether you're 3 years old or you're 93 years old, that's beneficial for skin health. And there is a lot of merit to making sure we take care of our skin from a barrier standpoint. So we're supporting the functions of the skin, whether it's the immune functions or it's just the physical wall barrier function. But having a cleanser, a moisturizer, and sunscreen, it could be things that are in the $15 to $25 range at the drugstore. Of course, there are fancier products out there. Sometimes it's the packaging, it's the smell, it's the texture, and
Yeah.
those aspects we understand in skincare is also very important for a consumer because it encourages adherence, right? Compliance, making sure that the skincare routine consistency is maintained. So I understand and appreciate those components are important too, but going back to the basics and sticking with it and making sure someone is consistent with it. The cleanser, twice more definitely before bedtime. In the morning, it's not as critical. Sometimes people shower in the morning, and by sheer washing their hair, they're in the shower. That cleanse is sufficient if they don't want to use a cleanser. The moisturizer has to be twice a day, morning and evening. And then there's the sunscreen that has to go on as the top layer in the morning. And you could wear it with makeup. It would be sunscreen first and then makeup after, and then building upon that routine depending on specific skin concerns that the individual has, whether they're 18 years old or they're 58 years old. And I think that's really the angle and the approach, that having a healthy, sustainable skincare routine that actually helps the person and not overly irritates their skin would do. Because when you have this 20-step, 50-step routine, the problem is that sometimes things are not used correctly, they're overused. And then
Yeah.
the issue is that the skin ends up getting irritated. And as dermatologists, we see this presentation of irritated skin being, it's scaly, it's red. When patients, or individuals put moisturizer on, their skin stings and they get flaking. And then if they have, acne prone skin, that skin irritation from skincare products that initially might be trying to help the acne actually worsens their acne, worsens their eczema, worsens
Right.
their rosacea. So it's
Yeah.
actually not only not
Yeah.
helpful, it's counterintuitive to what that routine and those products are meant for. So that's why I think going back to the basics and then building up as needed. And that could be with the guidance of a family physician, with a dermatologist, if there's questions about it. But that's a much more sustainable and healthy way moving forward with that routine.
Yeah, because I think the market is so oversaturated. When I was young, my mother was we used soap, and then I would put like oil of Olay or something like that. My mother used oil of Olay, so I would steal her oil of Olay, which smelled really pretty, and or Pond's cold cream or something that was so basic. And then, but now people are just inundated with products, like so many products. And then there's the Korean skincare that's now, and the Japanese skincare that's buzzing. And you just don't know, like even cleansers. Is this an oil cleanser? Do you use Cetaphil? Then people say Cetaphil's bad. There's just so many conflicting um,
Yes.
like choices out there. Everything is just conflicting news. So you just don't know what to use. What do you use, doctor? What kind of cleanser do you use?
So first of all, for me, you actually, Mary, you pointed out an excellent observation and comment that skincare, when it comes down to it, is not one size fits all, and that's
Yes.
why there's so much out there. And then when even though someone really, speaks compliments about a product, then you try it and you're like, it's not that great, or it actually doesn't work for me. I'm breaking out from it.
Yeah.
And ultimately, what that is saying and reflecting is that everyone is different, because every one of us is different, including our skin type, our skin tone, the degree of oiliness, if there's any underlying, genetic pass down of certain conditions that might be, more prevalent in one family than another. And acne is a excellent example. Often if I have someone who has acne, when you ask them if their parents or grandparents have acne, they often do. So
Hmm.
like these are all different reasons and factors why skincare is not one size fits all. And that's why there's also so many products in the market that individuals have access to, that they may have to do a bit of trial and error before finding something that works well for them, that is actually compatible for their skin. Now, back to your question about what I use, and I want to preface that because what I use is what works for me.
For
And
you.
even
Yeah.
my own self, I've noticed that my skin has changed over time as I get older, and dermatologists do get older. Despite what the public
But their
thinks,
skin
we all
doesn't.
get older. We all get older, and we all will get older. We
Yeah.
all age, and so will I, and so will all dermatologists in the entire world. So, having said that, I mean, my routine, like I said, for me, I definitely have a cleanser. I personally, because my skin is oily, dry combination, depending on the season, depending on my activities, I like a foaming cleanser, and that's more in the summer and fall months. But then come winter and springtime, where the weather is still a bit dry, it's a bit chilly, I tend to use more of a cream cleanser. And it's
Oh,
not brand
interesting.
specific, but I tend to choose more of a foamier cleanser in the hotter, warmer months, and then a more cream cleanser in the fall and winter season. And I do use that before bedtime, but I don't use myself a cleanser in the morning because I shower in the morning after my workout. And then for a moisturizer, I rotate between different brands because I have access and I would like to also try things
Yeah.
that my patients are asking for my experiences with it.
Right.
So it's not, I don't use one specific brand, but I definitely do use a moisturizer in the morning after my shower. And I definitely use a moisturizer after my cleanser before bedtime. And then for me, because sometimes I have a little bit of pigmentation, not necessarily melasma, but I've noticed that as part of my aging process, I get brown spots, and we see more brown spots as a sign of aging in Asian patients or Asian individuals. So I do use something that targets pigment. Sometimes it contains a little bit of niacinamide. Right now, I'm using a product that has this, I guess, component in it called 2-MNG, or Melasil is kind of the proprietary name. But that ingredient is in the product that I'm using as a serum for pigment correction. And then I have, of course, my sunscreen. I use a mineral sunscreen. I like mineral sunscreens because I know the science behind it. All sunscreens are great. But if, sometimes people have sensitive skin, or they may have acne prone skin,
Yeah.
or because of the fact that, they might have a bit of pigmentation, mineral sunscreens can shield even more than just UVA and UVB. It can shield infrared and visible light, which can contribute to pigmentation. So I use a mineral sunscreen. If I'm on stage and I'm speaking, I don't wear, I rarely wear foundation, except maybe at Glow Gala. At a very special event, I would have my makeup done. But
Wow.
on a day-to-day basis, no makeup. But if I'm, at a conference or I'm presenting and there's going to be lots of lights on me and I don't use foundation, I do use a tinted mineral sunscreen to kind of, give it a
Yeah,
more
yeah.
look. So, but I definitely always have a sunscreen. And then I use also retinol and a vitamin C. So retinol I use before bedtime. Not every night. I use a retinol maybe like 2 or 3 times a week. I understand the merits of retinol. Of course, retinol or prescription retinoid products cannot be used if someone is pregnant or breastfeeding, as a
Right,
just,
right.
general
Well,
caveat.
that is one of the things, doctor, I was going to tell you about because I
Yes.
told you I was going to tell you what I've been using for 35 years.
Ah,
Um, and that is dun, 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 dun,
ah,
Retin-A,
Chattanooga.
micro Retin-A prescription. This is the 0.1.
Mm-hmm.
0.1. Now,
Mm-hmm.
I've told many people over the years, like to me, this is the holy grail. I don't know. And the reason I started using it was because I noticed that I was getting not acne. They used it for acne originally, I think, Retin-A, right?
Correct.
Was because
Correct.
after my first pregnancy, I started getting melasma. Or the
Mm.
for melasma from pregnancy,
The
so I was
pigment.
getting the
Right.
dark pigment. So my doctor said, well, you can try Retin-A. And so literally use it. I mean, I've been using it for 35 years and I
Right.
use it not every day. Sometimes I go like for months not using it and then I go back on it. But if,
Mm-hmm.
but I think that's why. My facial skin is different quality than the rest of my skin. And I really do think it's because I've been using this product for so long.
Right,
Um,
right.
be-
And I would say the number one anti-aging or positive aging, targeting lines, pores, pigment, wrinkles, texture, the number one still is still a sunscreen and just staying out of the sun. But
Staying
if
out of
you're
the sun. Yeah,
specifically honing on a skincare product, then a sunscreen. And it doesn't
right.
matter chemical or mineral. Of course, the number has to be at least 30 and higher, and it has to at least provide UVA and UVB coverage. And the reason why it's the number one is not because the retinol doesn't work. It absolutely works. And yes, that would be my go-to favorite number two, maybe
Yes,
1.5.
yes.
But we know the sun damages the skin, and it's not just about aging and lines and damaging collagen and elastin, but because we know it also contributes to skin cancer, which would break good skin health. So that's why if I had to choose a single product, whatever brand, then I would still choose sunscreen as a
Yeah, if you look at countries like North Americans love getting a suntan.
Mhm.
Suntans are still like they make you look healthy. They make your skin looks, it's a pretty color. But I know a lot of Asians do not go out in the sun. I mean, they're wearing big hats. They got the
Yes.
sunglasses on, like or an umbrella. So is it very is it a cultural thing that, certain countries, certain ethnicities like sun and others don't?
Absolutely. So it's, with us both living in the Lower Mainland,
Yeah.
I'm sure any of us need to do is to drive around in Richmond in the summer, and then you see lots of ladies in their car with a visor that covers
Yep.
their entire face. You can't even see their eyes or their mouth or their nose. They wear these
The
sleeve
visor. Yeah, those clear visors, right?
the visors some are reflective even. So then there's zero, like there's minimal light coming through. Then they're wearing these sleeve guards that cut all the way from the fingertips all the way up the arms. And they're basically UV treated sleeve guards on both arms.
Wow.
And then sometimes I've also even seen in the summertime, and these are breathable material, but they're UV treated, and these are basically I guess pull over cloth garments that would cover the neck and chest so that there's no sun on the neck and chest that can damage the skin. But back to your question about, is it a cultural thing? Absolutely it is. Because if you look at historically, if we're looking at European countries or, individuals of European descent, which makes up a lot of our current North American people,
Right.
we can appreciate that it was a status symbol. It was essentially a reflection of your status and your wealth and your socioeconomic background in society. If you were not indoors. You could go to the Riviera, you can go to south of France,
Yeah.
and you can go on a beach vacation, and then you come back and you're tan. And it's basically showing to people that my family or I am wealthy enough that I don't need to work all the time. I don't need to be indoors. I can have sunny destination vacations. So there's that aspect historically and
Right, right.
whereas for the Asian population, so we're talking about Korea, Japan, China, Thailand, India, Vietnam, Malaysia, Indonesia, Singapore, if you were, because your family wasn't as well off, then historically, we're going back hundreds of years, you have to work the rice paddies. You
Oh,
have to be
right.
outdoors and you have to be doing farming. You have to work the rice paddies. You were outdoors doing labor work. You were lifting things. So you were in the sun a lot. So if you were, quite tan, it's because you have to work
You were
outside
working. Yeah, you were a
for
working
for
person.
making
Yeah. Mhm.
meet with your family. But if you were living, you were a princess or you were part of the dynasties, you were in the palace, you were being served on, you're always indoors and your skin would be porcelain white. So
Wow.
those cultural and historical um, connections between skin tone and your socioeconomic background or your wealth, that still has, kind of continued to be passed on through generations. And even now, modern day, of course, we could work indoors, outdoors, we could go on vacation, and it's not so much tied to our social economic backgrounds. Those traditions and those connotations are still very much with us.
Yeah. Well, I want to take you to a whole nother area now because now that we're mentioning that how the sun can be so damaging. So someone like me or anybody that's over 40, 50 comes in and wants, I know you are a laser expert. Apparently,
Mhm.
so I am told.
Yeah.
Um, what treatments right now are you seeing that are not just hype, that they're really good treatments when it comes to like there's PRP, there's microneedling, there's different kinds of lasers. There's the CO2 lasers having like its heyday right now. It's all over social media. And I think that laser in particular has been around for a while. But
Yes.
now it's get a CO2 laser, the fractional laser. So you know all of them, but what do you think? What lasers and what treatments do you think really work for reversing skin or aging or sun damage?
Mhm. So for me to kind of frame what devices or what treatments out there would be effective, and essentially what you're asking is evidence-based, right? This is
Right.
scientifically backed. It's been tried and true. This is not just hype and trends. It we have to take a step back and essentially look at, in principle, what these treatments all do. And so the categories I think about these different devices would be either it creates a wound in the skin, and then the body tries to heal that wound, and in the process of healing that wound that is created artificially through a device or through a laser,
Hmm.
the body then produces new collagen and elastin. And that's how the skin becomes smoother. There's a little bit of tightening effects, and the skin looks a little bit more plump. The pores look smaller. And it's all related to the fact that the body hits a limit to how much own collagen and elastin they can produce at a certain age for the individual. And we offer these treatments, which creates these wounds. Body heals it, and then body produces new collagen and elastin to compensate and to heal, but also it's in excess of what normally physiologically our bodies would produce. Then there's another category where now we have extra color. So whether it's brown or red or purple,
Yeah.
these lasers and devices are trying to either absorb, or they're trying to break down, or they're trying to get rid of the molecules that are causing the red and the brown or different colors in the skin that makes their skin tone not even.
Hmm.
And when we look at someone who is, when we look at someone and we have a certain number in our brains of how old they are, whether chronologically they're at that age or not, it's not just one aspect. It's not just, oh, is their skin tone even? Is it because they have lots of wrinkles? Is it because they have deep folds? It's this global gestalt feeling that we can see on someone's skin whether we look at their face or their neck or chest. And automatically our brain processes all these different components of the texture, of the color, of
Yeah.
the pores, of lines, of shadows, of symmetry. And then very quickly, like probably within milliseconds, our brain's like, okay, this person's 35. I think this person's 60. Okay,
Yeah.
this person is probably 80. And that's how we kind of, our brains are programmed to
Right.
determine. So if I then think about kind of these different categories of what these machines and devices does, then that's when I would say, you know, again, it's not brand specific, but if you're talking about lasers, there are lasers like the CO2 you mentioned that evaporates the first, you know, top layers of the skin and creating an injury. And then the body wants to heal that, which it would under normal circumstances, assuming the person's healthy and they, you know, they don't smoke. And if they have other medical conditions, those are well taken care of because all
Hmm.
those things impair healing and repairing. Then the skin is able to, after this injury, where the first several layers is evaporated, essentially, it produces new skin to try to heal it. And then the end outcome is that someone ends up having much less lines, they have much less spots, they just have more new skin.
So it's
Similarly, if you're
basically an exfoliation. Like it's a
but a
hard.
very deep and assertive one, kind
Yeah,
of.
exactly. It's a
Kind of.
hardcore one. I was
It's
gonna
done,
say, yeah.
yes, it's a hardcore one, and it's has to be like CO2 laser especially has to be done by a physician because there can be also it's I always tell patients it's kind of like investing. If you want, sometimes if you are okay with high risk, then you can get high returns. But because of the high risk, then you need someone to help you manage that portfolio. So if you're
Yeah.
doing risky things, you don't want to just kind of go in and, you know, do that yourself. You want maybe like a portfolio manager to help you with that. So in the same sense, when you are doing a procedure like CO2, it can give great outcomes,
Hmm.
but the issue is that it can also have much higher risk of things like infection or you know, if people have herpes virus where they get cold sores, it can come back with a vengeance. Or people can get a lot of lightening or darkening of their skin after the treatment. So their skin tone after the treatment is not their own skin tone in the area that's treated. And these are all very real potential risks that can happen, which is why it needs to be done by a physician. It has to be monitored by a physician to make sure things are safe and effective. So then if I'm thinking not CO2, I'm thinking other lasers that are available in the market.
Hmm.
If someone has brown spots or red spots, then you can take a pigment targeting laser.
You know, one of the things I was gonna say about the fractional laser, or any laser for that matter, is I think it's very important that people go to a physician to have this done. I know in the States, you can go to different clinics that they'll do CO2 lasers there, and there's no physician there. But I also think I've actually had a fractional on my neck once. I won't say where, but I mean, it was in Vancouver, but it didn't heal for a year. Like it was so red because
Oh.
I always my neck is my nemesis. But anyway, it's like it took so long for that to heal. Like it was burnt, like it was really, really painful. And I didn't go to a doctor. I went to a clinic. And so I want people to really know that if they're going to get something that's, a laser of some sort that is going to effectively damage the skin, go to somebody who knows how to use it because there's so many clinics out there now that, you can walk in Yaletown, for instance, and there's clinics on every corner. So not
Yes.
that they're, I don't know if all of them are good or not, but I'm just saying you don't know, like you've got to make sure that you've got the proper clinician working on you, right? And do your homework.
I no, I absolutely agree, Mary. You know, I think when it comes to, it's not just about the physician or the healthcare professional who can deliver the treatment, but it's also the experience, the competence, and the knowledge of
Hmm.
managing things if it goes wrong. And the way maybe I can frame it to the public is even if you have an excellent doctor, we're humans, and it's not that every single time we're going to have a home run.
Yeah.
And because everyone's skin is different and doctors are humans, and it's not it's not like a computer or robot mass producing the results.
Right.
And with the variability in different individuals,
Hmm.
because we're all unique, then it's about also being able, when problems come up, be able to manage it and walk that patient through so that they recover from it. And if for any doctor out there, if we do enough treatments, then we're bound to have some side effects at some point. And it's almost like if you fly in an airplane, at some point you're going to have a flight delay. If you don't fly a lot, then you might never run into a flight delay. And it's not because delays don't happen. It's just
Yeah.
that you're not going to encounter one because you don't fly a lot. But if you're constantly flying, at
You're
some
bound
point
to. Yeah.
yeah, or lost luggage. And like, we might not have the misfortune of losing a luggage, but we always hear people losing their luggages or their airlines losing them. Why? It's because if people fly enough, they might run into these problems. And it's the same thing. The side effects, especially for physicians, dermatologists, plastic surgeons, many of us are very well aware of them. Sometimes we might encounter them, sometimes in the course of our career we might not. But in fact, I would say those of us, my colleagues and I, if we actually are very busy with the work that we do and we do lots of treatments for many patients out there, then of course, none of us will ever say we've never had a side effect. But knowing what to do, knowing that we can help our patients get through that, understand that there's a timeline to which those side effects can be resolved. Um,
Because there's
that is
always
also
some
the other
downtime,
component.
right? There's always, if you're going to do something like that, any kind of these lasers or CO2, you've got to be really prepared for the fact that you are going to have downtime.
Absolutely,
I think
yes.
there's almost a misnomer out there, like because of social media again, where, oh, wow, I'm just going to walk in, I'm going to get the CO2 and I'm going to look like this. And in 2 days, I'm going to look normal again. And you're just not, right? So there's a lot of healing that has to go on
Of
and
course.
recovery and things like that. Doctor, what about things, the other buzzwords or the buzz treatments like microneedling or RF, radio frequency, and the Morpheus and the Moxie? There's all these different treatments. And I know they, like sunscreen, some of those are now getting, we're being told don't use them. Like they're not good. When you're injecting these needles way down into your face, it can take the subcutaneous fat and melt it. So that
Mm.
can be a problem. What do you say about all those treatments?
Okay, so microneedling and radio frequency microneedling definitely has its merits, has science, it does work. Ultimately, whoever is delivering the microneedling treatment or the radio frequency microneedling treatment, it's very operator dependent, right? So, whether
Mm,
it's microneedling in a clinic, and I do tons of it, I'm publishing a textbook on it, I speak about it. It's a mechanical microneedling that I do in a, electric pen, or in a clinic where there is, like you mentioned, some of the brands, these are radio frequency microneedling devices. So it's part of a, machine setup. There is needles at the end of that handpiece, but there's energy that gets delivered simultaneously as when those needles enter the skin. That's radio frequency microneedling in a nutshell.
right.
Um, it still comes down to the person who's delivering the treatment, because the microneedling pen or the radio frequency microneedling devices, they're inanimate objects. They
Right.
don't do the treatment onto patients by themselves. It has to be someone delivering the treatment. So the microneedling and RF microneedling or radio frequency microneedling, the principle that underlies these treatments and how they work is that they stimulate collagen by creating a wound. You're puncturing the skin with these tiny needles, whether it's at the end of a pen or it's at the end of a handpiece. And then if it's radio frequency, there's also radio frequency heat or energy that's also delivered along that needle when the needle goes into the skin. But it's creating this wound. And then once again, going back to our principle of the lasers,
Yes.
we're encouraging the body to stimulate collagen because it's trying to heal those wounds. And that's how scars or stretch marks or skin textures or pore size, that's how things improve with whether it's mechanical microneedling or RF microneedling treatments. It's interesting you asked me this because a few weeks ago, the FDA in the US just put out a warning against radio frequency microneedling. And the warning is that there is the risk of burns and hyperpigmentation that can result from the treatment that the FDA wanted the public to be knowledgeable and aware of.
Okay.
Now, when they put out the warning for my colleagues and I as dermatologists, and those of us who do radio frequency microneedling or microneedling, we're not surprised because these warnings and risks that the FDA cautioned the public about, we were well aware of them.
You're aware of them. Okay.
We were well
Yeah.
aware of them. But it's like you said, it's because there's so many medi spas and clinics that may or may not have physicians that may or may not have, the appropriate professional who's doing the treatment.
Hmm.
That's why. But then there's so much of this that's so prevalent now in our society, in the communities that we live in. That's why the FDA said, you know what, we got to put our foot down. We need to let the public know because there's lots of people now getting hurt by these devices, not necessarily because the technologies are not tried and true and not safe and effective, but it's not being regulated enough and it's not being delivered in a responsible way so that patients are actually getting not only results but not running into issues.
But is that
But
the same with the RF or the microneedling and the something like the Morpheus 8? Because I read specifically about that treatment that the needles are longer, I guess, that they're puncturing with, so that way I guess it can melt the subcutaneous fat of the face, which is obviously you don't want that to happen. Is that still under that FDA warning? Is that machine as well, or is it just for radio frequency?
it's more for radio frequency microneedling.
Okay.
And it's not even necessarily related to the needle puncturing the skin at a certain depth, because it's more related to the fact, is the delivery of that heat and needle into the skin done in a way that actually breaks protocol that's safe or is too aggressive? Because
I see.
if you take any devices that gives heat, and heat at some point beyond 60 to 70 degrees into the skin will accumulate and pool. And yes, there is a chance that it can melt fat. And as we all age, we actually want our skin to be plump and we want our faces to be full. And melting fat in this way is not a good idea, because if you melt or, melt fat, there's a chance that fat would be melted forever. And then we are now not only aging, but we're basically contributing to the aging signs. So the issue with fat loss with some of these devices that are out there, it's not the technology itself that is the issue, because the technology was created with some of these safety conditions in mind already. But it's how aggressive that treatment is being delivered, or maybe the depth of the needle is used on a site where it doesn't require that depth. It
So
would
it
be
goes back to the
inappropriate.
technician.
It goes back to the person who's delivering the treatment,
Yeah,
which is,
he's
it
doing
goes
it.
back to your comment earlier about making sure you do your research, have a trusted healthcare professional. It could be a dermatologist, it could be a plastic surgeon, or I've other colleagues who are in medicine who do it. And if they are not doing it and they're delegating that treatment to a nurse or
Yeah.
a nurse practitioner or an LPN or a laser technician or an esthetician, that they are following protocol and being supervised by a physician who can oversee the process. And if and when something bad happens, then at least it would be managed appropriately and quickly so that we can lessen the blow or the impact of potential bad outcomes that might come up from time to time.
But on the upswing, I think people should
Yes.
know that they are amazing. It's amazing technology, and that
Yes.
the what it can do for your skin is incredible. But just make sure
Yes.
you're going to someone that knows the proper way how to use it. I mean, just do your due diligence on where you are going to get these treatments, and making sure that the person is very knowledgeable about how to do it. I think it's really
Correct.
important. The doctor that I had on, the plastic surgeon from Toronto, he was came on the podcast a couple of weeks ago, was saying that one of the issues he has as a surgeon, if somebody was considering getting a facelift or a neck lift, is to be mindful of the treatments that they do prior to coming to him, because he actually went into, he had a patient that had quite a few Morpheus 8 treatments, didn't tell him, and he went in there for a deep plane, and everything that he, it was very difficult for him to complete the surgery.
because there's scars.
And because it was all kind of together, he couldn't lift the layers properly,
Mm-hmm.
I guess. There was some, yeah, they're all melded together. So
Mm-hmm.
he couldn't peel the layers back easily enough to get down to the deeper layer or something like that. But it was just more or less that he said he really needs, people should be very aware of what they're doing if they're going to come in for something like that, because those treatments can also affect the way that his work would end
Yes.
up.
Yes, that is true. And it's not just with radio frequency microneedling, it's not just with other energy devices, also with even injectables, right? So
Right.
if, there's a lot of popularity of medical tourism these days because individuals for cost reasons, for trendy reasons, people are going to maybe Korea and Japan and Brazil and Mexico for non-surgical, minimally invasive treatments. And sometimes some of the products that are being put into the skin and sometimes deeper layers of the skin, maybe something that would not be approved by Health Canada, or it's not available, or it will not make its way to the North American market.
Right.
And then the trouble is that, yes, if someone wants to do other treatments, whether it's non-surgical with a dermatologist or surgery with a plastic surgeon, then it could interfere because it might cause nodules. It may have produced a bit of abnormal scarring. The product itself may be obstructing things that we want to do. So these are all considerations,
Yeah.
about finding the right person, finding the person who's credentialed, who's experienced, but also yeah, making sure that just not chasing trends or kind of going to maybe a different country without doing all that work and research, and then coming back, and then we might have a hard time figuring out what to do next to help a patient too.
I wanted to ask you about the Japanese and the Korean skincare, because that's the other thing that's kind of happening is this, everybody's going crazy for Korean and Japanese skincare. And is that hype, or is it that they are just more advanced?
It depends on the products and the formulations. So there is a lot of trends and a lot of popularity with, K beauty and J beauty.
You're right.
The If I take one product type category, sunscreens, for instance, the way the sunscreens are made in Japan and Korea is different than North America because in Japan and Korea, since individuals want to be white and
Yes.
very fair, sunscreens are not viewed as kind of medical products or just sunscreens. They're actually viewed as beauty products, no different than the anti-aging cream. And because the historically the sunscreens has been viewed as a beauty product and not just a sun protection product, there's often ingredients that are added in to smooth lines, to reduce inflammation at the same time, to make the skin more glowy, and
Right.
on top of protecting the skin. And so I think some of the focus now and the popularity with the K beauty or J beauty is because some of their formulations really have the focus on skin complexion, on glow,
The glass
even though they're
skin,
supposed to
the
be
glass
protective.
skin, right?
Yes, this Korean glass skin where there's, no makeup, there's no foundation, but there's this nice even glow and, reflection of the complexion. And the skincare products are manufactured or formulated with trying to reach that goal in mind.
So like
So,
PDRN, what is PDRN? Because that's another like buzzword that's out there. PDRN.
so PDRN is polydeoxyribonucleotides.
Okay.
And essentially, these are molecules that can be derived from different sources. And one source is salmon.
The salmon
That
sperm.
is, yes, that's farmed specifically to produce this PDRN. And I was in Korea just a week and a half ago at a conference, speaking at a conference. And when I went into their version of, their beauty stores that are
Right.
chained in every block, they had PDRN creams, PDRN masks, PDRN serums, PDRN cleansers. And yes, it's very, very trendy right now. The thought is that this PDRN would be able to rejuvenate the skin because it essentially is almost like an essence that kind of kickstarts some of the regenerative properties of skin cells. And so if you're using it in a product, whatever, kind of product
I've
it
got
is,
one. I've got this one. This is called,
uh,
this is Rejuval.
oh,
Rejuval. I don't know. It's like it's a PDRN Korean something or other. And I
mhm,
noticed when I use it that, but it's hard for me because I use Retin-A too. So I don't know if it's making me peel or if the Retin-A's, I mean, I'm not really
uh,
sure, but I do know that this must have some peeling power
uh,
to it.
yeah, it's, I mean, without looking at all the different ingredients that's
Yeah.
in that particular product, it's hard for me to say if there's exfoliating properties to PDRN in itself. It's not supposed to, the ingredient alone as a solo ingredient, it's not supposed to peel
Oh,
because
okay. It's
it's
not
not meant
supposed to. Okay.
it's not meant as an exfoliating product. It's more a molecule that when you put it on, it's felt to, like I said, kind of, it's almost like a booster for the skin cells to produce, to regenerate a little bit better than if there was no PDRN put on the skin. I mean, nowadays, even though it's not approved and we are now seeing rashes and breakouts from it, yeah, PDRN in some regions are even being injected. But I
Right.
highly
I've
caution
seen that.
against
They've
that.
injected, like they inject it all over the face. I've seen that on
Yes, yeah, but I
something.
highly caution against that because we just have not evaluated where it's breaking skin barrier and put deposited or put into inside the skin. But topically, so far, some of the early research shows that it, helps with skin glow and complexion, and because it's supporting regeneration, it can help with some fine lines. But that is, there's a lot of innovation in, not that there's no innovation in North America or Europe, but I guess the focus has always been, the focus is a little bit different depending on which country and which continent you're in. And I think a lot of the social media does drive those trends as well.
Yeah, but I
um,
think your point earlier, doctor, about the Asian communities and not them not wanting to have the sun on their face and not wanting, it's a different culture. So
yes,
I think that may be another reason why it
of
drives the
course,
innovation. And
yes. But also often why people think, oh, people always comment, oh, you're Asian, you'll never age. And
yeah,
it
that's
sounds,
true.
we do age,
Yeah.
and we do show signs of aging. But I think it's going back to those very basic, simple principles that a lot of individuals in Asian countries, we just don't like sun. We avoid the sun, like extensively. We do a lot of things, and our behaviors are so ingrained culturally and historically to avoid the sun. Sometimes, I do think maybe it's not the products after all or the treatments. It's also just, your day to day sun practices and behaviors that
Um,
actually alters how different people of different cultural and ethnic background ages.
Yeah, I think that's really important to look at and to remember. Well, thank you so much for talking with me. I know I've gone over the I've gone over, so we could have talked forever, and I so appreciate you coming on, doctor, and thank you for all of your advice. And I'm going to let everybody know how they can get a hold of you. And I know you're on TikTok and you're on
No, I'm not
Instagram.
on TikTok. I'm
Oh,
not
you're
on
not on
TikTok. I'm
TikTok.
too busy, but I am
You're
on
on Instagram?
Instagram.
Okay,
And
so
yes, yeah.
but thank you so much for all of your information. I'd love to have you back on again.